So welcome everyone. Thank you so much for joining us this evening. I'm Katie Arnup. I'm the Executive Director at Canadian Doctors for Medicare. We are really honored and excited to co-host this important discussion with the Coalition for Dental Care this evening to explore the challenges and possibilities in Canada's dental care system. As you may know, this conversation comes at a promising time with the federal budget in 2023 having secured $13 billion over the next 5 years to fund the Canada Dental Care Plan. But we're really looking forward to talking about what that really means and what comes next. Before we get started, I would first like to acknowledge that while we are meeting virtually this evening, the CDM office and the home from which I'm calling in today are both located in Toronto on the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. Toronto is within the lands protected by the Dish with One Spoon Wampum Agreement. In the agreement, the dish represents the land that is to be shared peacefully, and the spoon represents the individuals living on and using the resources of the land in a spirit of mutual cooperation. This agreement captures our responsibility not only to the land, but to one another as well, which is certainly relevant when we talk about expanding access to healthcare services, including oral health. As you are all joining us from across the country, indeed perhaps outside of Canada, I encourage you to consider the traditional territories upon which you live and work. We must also recognize and underscore the significant and unjust health disparities that Indigenous peoples continue to face today due to systemic racism and the ongoing effects of colonialism. At CDM, we are committed to working to reduce those inequities as part of our work to advocate for better Medicare. For anyone who is new to Canadian Doctors for Medicare, we are a nationwide evidence-based and nonpartisan organization dedicated to preserving and strengthening Canada's publicly funded healthcare system. We advocate for innovations that are evidence-based and improve access, quality, equity, and sustainability. We are also proud to advocate for a single-payer public dental care system. We know that oral health is an important part of an individual's overall health, and that a single-payer public dental care system is an efficient and equitable way to ensure that everyone in Canada has access to the care they need. I believe my colleague Zarif will be sharing a link to our position statement on dental care in the chat shortly. So be sure to keep an eye on that section of your screen throughout the evening, because in addition to the conversation we hope you'll all be participating in there, we will also be sharing links and resources throughout the discussion. Before I introduce you to our host and moderator, I'll just run through a few quick housekeeping matters. This webinar is being recorded so that it can be shared with those who couldn't join us this evening. Please feel free to open the chat and send messages either to the hosts and panelists or all attendees throughout. We definitely want to hear where you're calling in from and why this issue is important to you. The discussion will run until approximately 8:15 p.m. Eastern to ensure we have lots of time for your questions. We also completely understand if you need to leave early or on the hour. Thank you for sharing part of your evening with us. You can ask questions through the Q&A function at any time during the webinar, and we will try to get through all questions, but we'll also follow up over email if we don't have time to address your question tonight. Closed captioning is available for this meeting, so please feel free to turn it on. And now I'd like to introduce you to Dr. Brandon Doucet, who will be moderating and hosting this event. Brandon is a dentist who graduated from Dalhousie in 2019. He is the founder of the Coalition for Dental Care, which seeks to highlight the shortcomings of Canada's dental care system while advocating for a more humane alternative. He recently published a book called About Canada Dental Care with Fernwood Publishing to explore these issues. Brandon, over to you.
Thank you, Katie. Before handing things over to our three exciting panelists, I would like to kind of set the scene on the current state of dental care in Canada, which is a story that I go much more in depth on in my book About Canada Dental Care with Fernwood Publishing. So if you're interested in some of the things we talk about today, I highly suggest that you have a look. So to get started, in its most basic terms, in Canada, dental care is not included in our universal healthcare system. And as a result, it has many of the flaws of the private American healthcare system. 1 in 3 Canadians lack dental insurance, and over 1 in 5 avoid the dentist each year due to financial constraints. These are numbers that have been actually on the rise as the rate of unionization has been declining, which has resulted in work becoming more precarious and fewer employers providing benefits like dental insurance tied to their labor, and many elderly people are retiring and losing their work-related benefits. The worsening in access to work-related dental insurance has also coincided with a decrease in public dental spending as a share of total dental spending. In the 1980s, public dental spending accounted for around 20% of dental spending, whereas now that number is around 6%. So this decrease in public dental spending has resulted in the existing public dental programs being eroded, often only covering part of the cost of emergency procedures and completely neglecting preventative services and early intervention. The fees these programs pay out are often around half of what private dental plans pay, leaving patients to struggle to find a dentist who will accept them or face prohibitively high out-of-pocket expenses. In many instances, these programs used to cover, let's say, all children, but now they only cover low-income children, which create gaps in coverage. All of these factors have led to Canada being an outlier internationally in access to dental care. For example, the 6% of public dental spending as a share of total dental spending is second worst amongst OECD countries, ranking even worse than the Americans at 10%, and way behind countries like Germany and Japan, where public dental spending accounts for around 57% and 78% of dental spending, respectively. And lacking access to dental care is problematic because it forces poor oral health onto people. Poor oral health leads to many consequences like diabetes complications, worsening heart disease, and increasing rates of aspiration pneumonia, amongst many others. Having missing teeth or visible decay can affect employability, which perpetuates the cycle of poverty. In the time people lack access to care, disease only worsens, which can lead to potentially life-threatening infections. There's a story that I like to tell that highlights how access to dental care, like lacking access to care, it's incredibly cruel and inefficient. There was a story in CBC News about a year ago of a man in his 30s named Shane McKenzie. And this gentleman had a dental infection that overwhelmed his body, leading to sepsis, which required him to be placed in a medically induced coma for 10 days, followed by the intensive care unit for a month and a half, and in a long-term care setting for a year. In this time, he lost his right leg below his knee, all of the fingers on his left hand, and some of the other fingers and toes on his remaining limbs. He required dialysis for his kidneys and many surgeries. All of this pain and suffering, along with tremendous use of healthcare resources, all because Shane lacked access to dental care. Whereas this pain and suffering could have been prevented for much cheaper with upstream investments in public dental care. While Canada's current dental care system has made life harder for most Canadians, it has been beneficial to certain industries, which have fought tooth and nail to maintain the status quo. While I'm sure many of you are aware of the news of the federal NDP dental plan potentially coming to fruition, which seeks to provide dental insurance to all uninsured people with a family income below $90,000 per year, with no co-payments below $70,000 per year in a stepwise fashion before the next election in 2025. By the end of 2023, the program could be extended to those below 18, seniors, and people living with a disability who are below the income threshold. It's important for us to place this plan in context, which is something I hope we do in this discussion. The plan, it could be the largest investment in dental care in Canadian history, bringing public dental spending from around $1 billion per year now to around $5.5 billion per year if the plan gets fully implemented as outlined in the 2023 federal budget. And this could cover up to around 9 million people. This would bring Canada to around the average of OECD nations in its share of public dental spending as a share of overall dental spending. But there are also problems such as many of the financial interests that I've mentioned would relatively be left untouched, which would still leave inequalities in access to care. Further, targeted dental programs have had a tendency to erode over time in comparison to universal programs like Medicare. Also, the plan itself, it's not in place yet. This is why I think we need to keep up the momentum around this issue to help get this plan fully implemented and keep fighting so that it can be a stepping stone towards a truly universal dental care system where Canada would be a world leader in dental care that ensures everyone has access to timely, comprehensive care. So now that we've kind of laid the groundwork for where dental care is in Canada, I would like to turn things over now to our panelists. We will then move on to a Q&A session with the questions that you as the audience provide. Throughout the discussion, as Katie mentioned, you can pose questions in the chat box, and we will put those questions to our panelists in the second half of the webinar. So exciting that we have three excellent speakers with us tonight that I have the pleasure of introducing to you. First is Mary Otto, who is a Washington, D.C. based journalist who began writing about oral health at the Washington Post. After leaving the Post in 2008, Otto spent an academic year studying oral health at Harvard as a Knight Science Journalism Fellow. She now works as an independent journalist. She is the author of the book Teeth: The Story of Beauty, Inequality, and the Struggle for Oral Health in America, published in 2017 by the New Press. And I would like to add that that book was a big inspiration of mine in writing the book that I've written about Canada dental care. So I'd just like to thank you for joining us tonight. And I was just wondering, Mary, if you could tell us about the structure of dental care in North America and how it's shaped the priorities of dentistry and what are some of the consequences of this. In particular, I'm referring to, the growth of cosmetic dentistry being such a high priority for dentists while so many people are unable to afford even the most basic care.
Excuse me. As I was listening to you and Katie, Dr. Doucet, I was thinking about the parallels between the U.S. dental care, the challenges, some of the challenges we face here in the United States and the challenges you were speaking about in Canada. I got started covering the issues of oral health, writing about the death of a young schoolboy here in the United States. He lived and died not too far from the U.S. Capitol, but he experienced, like your patient you talked about, a dental sepsis. It was a complication of a routine decayed tooth that became abscessed, and his mother had actually been looking for care for his younger brother, who was complaining about some dental problems when Diamante came home from school one day with a headache and it turned out a sinus infection that was related to this abscessed tooth. And $250,000 worth of hospital care and therapy didn't save him. He succumbed to that infection, and it opened my eyes to the sort of separate system that we have and the tensions between the private practice fee-for-service system that we have here in the United States that serves people with good dental benefits. They usually get them through their workplace, and the money and agency to have a dental provider in their community and to take time to get the care, the routine care, and even the cosmetic care that they can pay for out of pocket, and the people like the Diamante drivers of the world, which represent roughly a third of our population, who really experience significant barriers getting even the most routine basic care, that timely, cost-effective preventive services that help people stay in a state of oral health. They might not have a Hollywood smile, but they have healthy teeth and a healthy oral, and they have oral health. Dr. David Satcher, a former U.S. Surgeon General, highlighted all these problems in a landmark 2000 report, Oral Health in America. And that book was a guidepost for me and all the work I've been doing ever since to write about oral health care and America's oral health crisis. And there's always been a tension here in our country between private practice, fee-for-service care, and the public health imperatives of getting cost-effective, timely, routine services to our entire population. And that tension endures. We have a program here in the United States called Medicare that covers about 60 million elders and disabled Americans. And periodically there are pushes to get dental care included in that program. Since 1965, that program has provided seniors, after we retire, we often lose our dental benefits. We go to Medicare for our full range of healthcare services, but Medicare has never included routine dental benefits. Only the smallest number of dental services can be found under Medicare, and there are constant efforts by oral health advocates to get these services included as part of what it takes to remain healthy, to be able to eat, to speak, to communicate, to feel confident. But there's always a strong backlash, to including them too. So seniors are just one group, that lack routine care if they don't have the benefits or find a way to pay for them after they retire. Minorities, like Katie mentioned, are Native Americans, are Alaskan Natives. Many minorities, our oral health workforce is largely a white, white oral workforce. Our private practices are largely located in more affluent metropolitan areas, where there's not only a lot of well covered people who have the money to pay for elective services, but there's a market for these remunerative elective services. And those have been popular. I mean, it's interesting and ironic. I learned this as I did my reporting for the book. Cosmetic dentistry in America was really born in the Great Depression. It was kind of a byproduct of our Hollywood film industry. And then back in the Great Depression of 1929, talkie movies were just starting to be popular, and people would pay a couple of pennies just to go to the movies and escape the hardships of daily life. And a dentist named Charles Pincus went to the movies too. He just opened his practice in Hollywood, and he was having trouble making ends meet. There just wasn't much of a market for dental care in those hard times, that he looked up at the silver screen, and the movie stars didn't even have perfect teeth back in those days. So he invented these Hollywood veneers that the stars could snap into their mouths, so they looked like it created the illusion of perfect teeth. And even little Shirley Temple, the child star, we never saw her lose her baby teeth. She always wore those Hollywood veneers, right up through puberty and adulthood, when she had perfect teeth. But anyway, that illusion of perfection became part of this sought after status symbol, And, we started having water fluoridation and things after World War II, and decay rates actually started to decline, in many populations. And dentists started to worry that they were going to lose, their livelihoods. And new interest in cosmetic procedures was kind of boosted by the fact that a Supreme Court decision in early 1980s allowed medical advertising to be permitted. So people started advertising elective procedures, dental procedures. Banking deregulation allowed these medical credit cards to be marketed, so people could pay for elective procedures like on the installment plan, kind of, or through, medical credit cards. And all these new bonding techniques became available to dentists, so they could create very sophisticated dental veneers. And now, people pay tens or even hundreds of thousands of dollars for some of these complete dental makeovers, for special occasions or for photographs, wedding albums. Yet again, we still have roughly 100 million Americans who lack the most basic access to some of the most basic routine services. Our public programs for Medicare and Medicaid, which covers low-income Americans, has always considered dental benefits optional to the states for poor working age adults. And yet often if people don't have confidence in their smile or a nice smile, they lack some of the, they experience stigma, and they are last chosen for some of these customer facing jobs that can be a ladder out of poverty. So the oral health or the lack of it can become kind of a deadly cycle for people who are trying to work their way out of poverty and into a job that would provide them with oral health benefits and a way to move up socially and economically. So the work goes on here, it's safe to say.
Thank you so much, Mary, for that. It's so interesting hearing your perspective from more of a US perspective and seeing so many of the similarities here in Canada as far as the tension between, is dentist chair time going to be focused on doing luxury and cosmetic procedures for people who have all of the money and good dental insurance? Or are we going to focus on medically necessary dental care based on need rather than the ability to pay? And that's really a byproduct of how we structure the system.
Yes.
Canada, we pride ourselves in universal healthcare so much, but, dental care is very much treated like the private US healthcare and dental care system. So thank you for that interesting perspective. I would like to move on now to Dr. Hasan Sheikh, who is an emergency and addiction medicine physician in Toronto and is an assistant professor at the University of Toronto Department of Family and Community Medicine. He is a board member of Canadian Doctors for Medicare and helped co-author the Canadian Doctors for Medicare's position statement on the need for public dental care in Canada. So thank you, Hasan, for joining us. I was wondering if you could talk to us about the relationship between oral health and overall health, and why, as an emergency physician, you believe dental care should be treated as healthcare.
Yeah, thanks so much, Brandon. And, my interest in our dental care system actually came very differently than the stories that yourself and Mary brought up. You brought up stories of patients who were really sick because of inadequate dental care. And for me, what actually piqued my interest was the opposite. It was working as an emergency physician where our EDs are overcrowded and we're always stressed for resources. And noticing that every, shift or two, I was picking up these charts where once I read the triage note, I knew exactly what was going to happen. I was going to walk into the room, someone was going to be struggling with really severe tooth pain, and I was going to know that really the answer was that they needed to see a dentist and that there wasn't a whole lot I could do. And what became very obvious was that the patients knew the exact same thing. They knew that they needed to see a dentist. They didn't want to be in the ED either, but they had nowhere else to go. And it really was this idea that I was witnessing these failures where we were failing the individual, but we were also failing the system because we're putting further strain on the emergency departments. We're paying for these visits. We're spending the money and we're not actually getting reasonable outcomes or providing the care that people need. And so then I started to look into, the very strange system that we have where this one part of your body is treated as if it's not part of your overall health, but then everything else is, right? And, what was so magical about the teeth in your gums that it was suddenly not related to your overall health. And when you look into it, spoiler alert, there is nothing special about your teeth and gums. They are part of your overall health. And I remember learning in medical school about some of these associations that, people with poor oral health had higher rates of cardiovascular disease, diabetes, metabolic syndrome, stroke. But then when I dug into the literature more, it was very clear that actually this is not just a correlation, there's a causative effect. That when you provide people with cleanings and oral health care, things like their diabetes improve to a similar kind of amount as one of the oral, hypoglycemia medications that we prescribe. And as you provide people with oral health care, their mental health improves, their cardiovascular risk factors improve. And it's because of this kind of chronic inflammatory state that happens when you have poor dentition. Not only that, your smile is such an important part of your mental health. It is something that is very strongly related to self-esteem and to social interactions. And as Mary mentioned, related to employability. And we want people to be happy, healthy, productive members of society, yet at the same time, we're failing them by just taking this one piece of their health out of the whole system and doing it in a way that makes very little sense. And it makes very little sense, as an emergency provider, because as I mentioned, we're seeing these individuals and it's a very large proportion of our visits. About 1% of all ED visits are for non-traumatic dental pain. And in Ontario, at least where I practice, that ends up being about $15 to $30 million a year that we spend on ED visits, where the providers are left dissatisfied, the patients are left dissatisfied, we haven't actually fixed the issue, and we haven't actually provided the care that people need. And so it's very clear to me looking at this issue that your oral health is part of your overall health. We have lots of evidence on the best way to structure a healthcare system to actually ensure that it's equitable and high quality and efficient. And that looks like a single payer system. And that's why, Canadian Doctors for Medicare, we came together to kind of review the literature, talk about the values behind the work that we do. And it became very clear to us that a single payer dental care system is the way forward to actually treat oral health like a part of your overall health and provide efficient and high quality care in the system.
Awesome. Thank you, Hasan. It's always great hearing from someone as part of the medical profession. As a dental professional, it's always great to hear someone from the medical profession talk on these issues. It's a very interesting perspective and a very compelling case for why we need to fund public dental programs. I'd like to turn now to our third and final panelist, Dr. Paul Allison, who is a dentist with specialist training in oral and maxillofacial surgery and dental public health and research training in epidemiology. He is a professor at the Faculty of Dentistry at McGill and was the dean of this dental school from 2008 until 2018. He was the president of the Association of Canadian Faculties of Dentistry and the Canadian Academy of Health Sciences, and has been on the governing council of the Canadian Institutes of Health Research. He is currently a member of the Lancet Commission on Global Oral Health and a project leader with the World Health Organization developing global indicators of oral health. So thank you, Dr. Allison, for joining us. I was just wondering if you could talk to us about access to dental care in Canada and what your opinion is on the federal dental plan so far, in particular for what it represents for shifting dental care towards healthcare.
Okay, thank you very much, Brandon, for the introduction, and thank you very much to you all for the invitation to participate. So I was very interested, first of all, I just wanted, before getting into answer the question directly, I was very interested in, Hasan, your perspective compared to Brandon's and Mary's, as you say, looking at the issue as a very common issue, which we can't deal with very well, compared to thinking of the really serious issues that sometimes do occur. And it reminds me of the fact that I'm, very aware of this with some of the roles I'm doing and my background in public health. And dental decay is the most common non-communicable disease in the world. That's, very well established and recognized through the World Health Organization. And the World Health Organization is now working very hard to write, and it will be voted on this coming next month, actually, I think it is, to confirm a global oral health strategy and action plan to try to address this situation, trying to encourage bringing oral health care across the world into general medical care, and also into universal health coverage. So I think that's a really good sign, and of course Canada will be a signature to that agreement. So that's a really good sign. So back to your question now, in terms of sort of access issues, I mean, you've brought out both you, Brandon, and Mary, and then somewhat indirectly, Hasan have brought up many of the issues, and I'm sure many of the listeners are very aware of these issues. But just to reiterate that there are lots of people in Canada who have good access to good dental care, but they are the people who can afford to go and see the dentist, and they can get very good care. They can afford to see the dentist because they've got the money, and or because they've got dental insurance, normally through their employment. The problem, the big problem, of course, is that there's a very significant minority, about a third of the population don't have any form of dental insurance. And a very large proportion of those people have by far the most dental disease. So these are the people who have the poorest access to care in terms of finances, because they can't afford getting the dental care because they don't have any dental insurance. But on the other hand, they also have the highest levels of disease. And this is exactly where a universal health coverage system comes into play. And we've had this debate in Canada, and I think the vast majority of Canadians will agree that it's really important to have universal health coverage, because all of us can be sick at any time. And we want to be able to go to our doctors and nurses and all other elements of our healthcare system to be cared for and to get better. For reasons of history, the mouth was taken out of the body and put into the hands of a different profession called dentists, compared to doctors looking after the rest of the body. And that's a matter of history, and it stayed carried on like that. And so we've carried on in these silos, and we're not at all well integrated in terms of integrating oral health care into general care. Now, the other issues with access, of course, are not just finance. So we've talked a lot about that, and that's a really big issue, of course, but it's far more complicated than that. There are plenty of people who actually would have enough money for at least some level of dental care, but for all other reasons, they can't get dental care, whether that be because they live in rural and remote parts of Canada, and so simply there are no dental professionals anywhere nearby, or they could be living in urban Montreal or Toronto, the big cities, and they can be living in a poorer part of the city where there are far fewer dental professionals available. And if they're poor themselves, then they may be able to get together a little bit of money to go and get the dental care that they really need, but they can't afford the transport, or they can't get the time off work because they're working 3 part-time jobs just to make sure they can get the rent paid and they can get some food into their mouths and everybody else in the family. So they're running around just trying to live, basically, and then they've got to find the time and the transport and the money to go and see a dentist, and they don't have insurance. So that's a really big problem for many people. And then we all heard lots about the really difficult situations of our long-term care centers during the pandemic. For all sorts of reasons, we heard about the really difficult situations. Well, those people, by and large, don't have dental care. And there are, I don't know how many hundreds of thousands of people living in long-term care centers, and that presumably is just going to increase over the course of the next decades as the demographics of our populations get older and older. And those people, they live in those places, and very few dentists, very few dental hygienists are going into those centers to provide care. And so do their families try and get them into a dental office? Sometimes that's possible. Often it's not, for all sorts of reasons, whether that be because they've got Alzheimer's, whether it be because they've got physical disabilities, whether they can't, again, afford it. There are all sorts of reasons. So that's a really, really enormous group. Then there's all sorts of groups like young children as well. How many young families have we heard they take their 2-year-old to the dentist, and the dentist says, no, I don't want to see them until they're at least 5 or 6. So they find it very difficult to get routine care, and they should be being seen on a routine basis, even though they probably don't need anything very much. But they need to be seen just to build up the habit of going to see a dentist and being used to having someone look in their mouth, et cetera, et cetera. And we could go on and on and on the list. Of course, indigenous peoples, immigrants and refugees, so the very young, the old, people living in rural and remote areas, and people living with disabilities are the sort of classic groups that have great problems accessing dental care. So coming back to your question about how the new program, my understanding of the new program is it's going to be a program which will help amongst those who qualify for it with the level of revenue that we've heard about, 70,000 and then 90,000 for a family's revenue. So they will get some level of payment when they go to see a dentist. Those services will be paid, that are covered, will be paid for completely or partially, depending on their revenue level. And that's great, because that will mean lots of people can go who couldn't otherwise afford to go and see the dentist will be able to go and see a dentist. And so this is a fantastic step forward. Let's be very clear about that. Personally speaking, I'm very, very pleased about this, because this has been something I've been talking about and pushing for, etc., for a long time. The problem at this stage, and we don't. There's lots of things about the program we don't know. The government's letting little bits out. They've started something temporarily for the moment, and I believe that there are going to be more announcements coming out this year sometime as they move things forward. But from what we know, as I say, it's going to be paying for basically people to go and see the dentist in a dental office. And that's great for the financial barriers, but for the distance barriers, the transport barriers, the long-term care center barriers, people with disabilities, that's not going to cover it. And people with disabilities, it may, for all sorts of reasons, they often essentially need very similar dental care to people without disabilities. But the issue is getting them to the dentist. And then it will often take longer to provide the care because it's complicated for all sorts of reasons, which I'm sure you can understand, whether the person's got mental health issues, cognitive issues, physical ones, a combination thereof, etc. So, is the dentist going to be paid, or the dental hygienist going to be paid the same amount when it takes 3 times as long to do that? That system's not going to work. And that's the same for people in long-term care. Is the dentist or the dental hygienist or the denturist, and now in Saskatchewan, dental therapists, are they going to be paid the same amount for going into the centers? And that's what really needs to happen. So the new program, as far as we understand it at the moment, is a great start in reducing financial barriers, but there needs to be a lot more done in terms of creating means by which dental professionals can go and provide service in other settings. And that includes different payment systems, whether it's being paid by the hour, whether it's being paid on salaried service. And it also means setting up infrastructure to provide dental care in a whole range of other settings, whether that be in long-term care centers. And we should have dental offices routinely in community health centers where you've got family physicians, you've got social workers, you've got nurses, you've got pediatricians, all the usual groups that are working routinely with the general population. So we take patients away from Hasan. Hasan's very busy in his emergency department treating people who've got very serious illnesses, and the vast majority of people with dental problems, it's not a very serious disease in the sense that they're not going to lose their life. Yes, we've heard the really serious stories, but they are suffering from real pain, and they do need to be treated, but they can be treated in a routine community health center. So we should be setting up facilities there. And that's when you start to really integrate oral healthcare and general healthcare, where the family GP is talking with the patients and their families, etc., and saying, you know, how you going, blah, blah, blah. Oh, you've got these issues. It'd be great. Do you have a dentist? You should go down the corridor, just 20 meters away, just down the corridor. There's a dental office. You've got diabetes. It would be really good for you to go and see about your gum disease, and that may help you, et cetera, et cetera. Or you've got young kids, and we know, you know, you're struggling to, you know, with your housing and the rent and all that sort of thing. We know those sorts of people are high risk for having a poor diet full of carbohydrates. Why don't you go down the office and get your kids' teeth looked at? Because we don't want them getting dental decay, because that's going to hurt. It's time off school for them and time off work for you. So again, it's a really good first step, what's happening. Fantastic first step, but there are a whole lot of other things that need to be done if we're going to really integrate oral healthcare into the general healthcare system.
Thank you, Paul, for such a great explanation and perspective. I'm really glad that you brought up the alternative dental delivery models other than just dentists focused in private practice, working on a fee-for-service basis, but looking at bringing dental providers to where people are, especially in places like long-term care settings, schools, and you know, places for people with disabilities, and having clinics that can meet these people's needs. Very much an important perspective. The federal dental plan, it is an exciting time because, as you said, you know, it can be the largest investment in oral health in Canadian history, but we really need to view this as just a stepping stone towards, you know, fully integrating dental care within our universal healthcare system. So thank you for that. I would like to hand things back to Katie now for the Q&A, and yeah, we will move to kind of a discussion between the panelists.
Sure. Thanks so much, Brandon. And thank you so much to all the panelists. I know the gears are turning in my head, and I feel like perhaps our participants are experiencing the same thing, because we've not seen a floodgate of questions in either the Q&A or the chat, but there's so much to take in. Luckily, we did actually also get a number of questions in advance of tonight, so maybe we can start there. I think, not surprisingly, we got a lot of questions about the Federal Canada Dental Care Plan, which we've touched upon a little bit of that just now. Thank you so much, Dr. Allison. One intriguing question, and this could be a jurisdiction question for another day, but perhaps one elephant in the room, an issue, if there's a problem, why not fix it? One member asked, why is the federal government creating a new system to manage dental care when we already have provincial Medicare? Why not just expand the basket of services and extend provincial Medicare systems to include dental care and increase the federal transfer payments to cover oral health? Anyone feel bold enough to answer that question?
I can kind of briefly talk about that. So from my understanding, if the government wanted to fully include dental care, like they would have to include everyone. They wouldn't be able to do it in a piecemeal way like they're looking to do. It would also probably take years to negotiate some sort of deal with provincial governments, which would mean it probably wouldn't come to fruition before the next federal election. And from my work that I've done with the federal MP, Don Davies, with the New Democratic Party, the health critic, he very much views the federal dental plan as a down payment on a universal dental care system, and this can help people most in need while, we can hopefully muster up the political will to have that conversation as a country, which could take, many years.
Hasan?
Yeah, I'm happy to build on what Brandon was just talking about, and I think ultimately it comes down to just the money that would need to go into integrating dental care into Medicare, and I think that highlights a couple other major issues that come around this decision of a fill the gaps approach versus a universal approach. One of the benefits of the universal approach, and one of the things we see in in healthcare systems like our Medicare system is that it also gives you the opportunity to control costs. You actually have some negotiating power in terms of what the fees that are charged for what are. And that's one of the things that can make a system more efficient, more sustainable. One of the challenges of kind of trying to pull dental care into Medicare at the stage that we're at is there'll be resistance from dentists, just like there was resistance from physicians when Medicare came about. And that can really be a major barrier. And I think, one of the big challenges we have to figure out how we navigate as we do this kind of short-term view of how we expand, dental services and access for people. Part of this also comes back to the Canada Dental Benefit, which, is a kind of a tax-free payment that you can get after you've incurred the dental care expense, which in and of itself is a barrier for people, one, to navigate that tax structure, but also to have the liquidity to actually be able to pay upfront and then get reimbursed, with the promise of getting reimbursed later. And again, highlights how lucky we are in our Medicare system to have that payment at the point of care so that you don't actually have to incur that as a barrier, even if you do get the money back later on. So once again, we just see some of the differences between our Medicare and our dental care system and some of the reasons why we're proponents of a single payer dental care system, but it's going to take steps to get there, unfortunately.
One question that was asked in the chat is someone who had recently been to see their dentist who seemed surprised by the new program. I think all of us agree that this policy file moved far more quickly than many people would have normally thought. But was the dental industry consulted in the rollout? In general, are dentists aware of the program, how it'll impact them and their patients?
I can start on that one if you want. So I think it was a surprise when it was announced initially I think it was March 2022, so just over a year ago. I believe it took everyone by surprise. There was clearly discussions going on behind the scenes between the NDP and the Liberal Party, and this was one of the important conditions for the support by the MDP of the Liberals, and so it sort of emerged just like that. And then also the fact that it has to be very, very quickly put in place. It's remarkable if it does go through the way they say it's going to go through, it's absolutely remarkably fast. So we were all very surprised. Again, I've been working in this field for 20 odd years, pushing for this, and was completely taken aback by this. And now my understanding is the federal government is consulting a lot of different groups, professional groups, academic groups, community groups, people, seniors, families, people, organizations representing people in poverty, etc. They're trying to get as quickly as possible as much information as they can to try to roll this out. And they came up with a temporary measure, as you all know, I'm sure, in December 2022. So that's what's in place at the moment, covering kids up to 12 years of age with certain dollar limits for their dental coverage. And now we're waiting to see what the real, if you want, program is going to look like. And as I said earlier on, I believe it's going to be announced. At least the next steps are going to be announced this year sometime. Although again, I think that's going to be for the main program, looking after the vast majority of people who can go to their dentist in the way that I was describing earlier. But again, issues around seniors and people with disabilities that we may have to wait a little bit longer to find out how they're going to manage those. So short answer was yes, everyone was surprised across all of us working in the dental world.
And just a follow up, one of the questions that a few people sent in was, who are the beneficiaries? What are the services that'll be covered? So just to follow up, perhaps Dr. Allison or someone else. So for now, it is predominantly geared to income, and there is more to wait on in terms of other populations, including seniors or people with disabilities, or how gradually this could expand to cover more people in Canada.
So my understanding is that that there's this overall limit for everyone, whether you're a senior person with disability, whomever you are, of $70,000 for a family revenue, where you get everything covered, or 90,000, between 70 and 90, you get partial coverage. So that's going to cover absolutely everybody who falls within those income brackets. And as Brandon said earlier, the estimate has been that this will cover approximately 9 million people in Canada. So what the phasing in is they've started off by targeting kids till their 12th birthday, I believe it is. And then after that, they're going to expand it to adolescents to their 18th birthday. And then they're thinking about seniors and people with disabilities. And then after that, anybody else who's within those income brackets. But those income brackets will always be, anybody who's got access to this program will always have to fulfill those income brackets. So in other words, if you're disabled, but you're earning $100,000, you will not have access to this program.
Brandon, I see your hand raised. Go ahead.
For sure. So to add to what Paul was saying there, the type of dental coverage, from my understanding, the program is going to work very much like a work-related insurance plan. But if your income is below a certain threshold, you won't have any sort of co-payments, but there still will be things like yearly limits and stuff like that, much like other insurance plans. I mean, the details are still to be seen, but from my understanding so far, that's what's to be expected. The coverage itself, like the funding for the program, I was very happy to see in the 2023 budget much more funding for the actual dental care plan itself. I believe the 2022 budget had around $5.5 billion over 5 years for the program, which was, definitely better than nothing. Let's not be frank about, or let's be serious about that. But I was skeptical that would be enough to provide comprehensive dental coverage to the populations that they're actually looking to cover, especially considering that these are people who, many of them have not been able to go to a dentist in many years. There's a lot of backlog of dental disease. And just in general, the population seeking to be covered have a higher dental need than, the rest of the population. So I was very glad to see in the 2023 budget that $5.5 billion going up to around $13 billion over 5 years, with about $4.4 billion ongoing. Because basically the reason I believe that funding has come about is because they realized more people lacked access to dental care than they originally thought. There's more unmet dental needs than they originally thought. And the actual cost of implementing this program, if you want to do it well, they could implement just like a poor person's dental plan, like a lot of the existing public programs we have that pay out very low fees. They don't cover many things, but if they actually want to provide decent coverage, they're going to have to really, put a significant amount of money towards funding this. One of my concerns with them taking this targeted approach rather than a universal approach is just these programs have a tendency to erode over time, as I've mentioned. The politics of targeted programs really do matter, because what ends up happening is there's a sense of tension created between those who are not eligible for the program but are actually paying in through their taxes, and they're resentful towards people who do benefit from these programs. And it creates a sense of political instability that makes these programs easier to undermine as time goes on. And with the existing dental programs that we have, we've seen the fees they pay out be de-indexed from inflation. We've seen them cut services that they actually cover, and also cut populations that they cover, which result in, a lot of pain and suffering for people, and is why we've seen public dental spending as a share of total dental spending going from 20% in 1980 to about 6% now. And one of my concerns with the federal dental program is, if we kind of do what we have now and fight for this, what happens in 20 years from now if we don't keep fighting to make this a universal system? Does that get eroded over time as well? What happens, if the conservatives come to power? What happens even if there's an election before this plan is fully implemented? What happens to what's there? And those are, very real concerns that we need to consider.
Thank you so much. I feel like a bunch of you are touching upon a question we got as well around, we often talk about pros and cons or differences between filling the gaps versus universal approaches. And I mean, we can't deny the fact that adding another patch to the patchwork quilt will hopefully cover more people. But are there concerns? I mean, we've seen with existing provincial plans where if the payout isn't the same as what the market is currently bearing for certain services, will people hypothetically be covered for services because they're covered under the plan, but no dentist will actually see them? Are there concerns that this will work on paper versus what would actually be achieved in something like a universal single payer plan, which is what we all experience in our other aspects of accessing healthcare services currently in Canada?
I can start with that. Yeah, I think that's a great question. And, to add on to something that Paul has mentioned earlier, is just, having dental insurance does not mean you have access to dental care. It's a very important component of it, but I see integrating dental care fully within our universal healthcare system is also being, addressing those other barriers, like making sure dental providers get to the people who need help the most. So the long-term care setting is a great example, because the amount of hassle that goes into getting someone out of a long-term care setting, getting them to the nearest dental clinic, is that dental clinic wheelchair accessible? All of these factors that we need to consider. Whereas the reality of that, if you're going to just give that person dental insurance, they're much more likely to only get out and use that dental insurance for emergencies, so getting out of dental pain. Whereas bringing dental providers to those settings is much more likely to result in those people accessing comprehensive care and having much better oral health outcomes. And, I really think we need to look at those alternative dental delivery models and, have that be a very central approach, just as much as we talk about public funding of dental care as well.
Just to add to that by saying, the point you're bringing up, Katie, is really important. It's, the focus of this discussion, quite rightly, is on us trying to improve access to care for those most in need. So that's a really important focus. But we do have to acknowledge that we want dental professionals to work in this system to provide high quality care. And to do that, they need to be paid a reasonable amount. I'm sure most dental professionals would say, well, in the public system, we accept that we may not get quite as much as we get paid in the private system. And so they'll be maybe willing to accept a little bit less. But there are examples of programs across the country in different provinces where they're getting 50% of or even less of what they would be expected to get in the private sector. And at that point, lots of them will simply say, I don't want to work in this system. And that's a legitimate thing for people to be saying. So I hope very much, I believe the government is very aware of this issue, has been having discussions with the professional associations and others who are telling them around, you've got to find the right balance between the public pocket good spending of public money, but also making sure that the large majority of dental professionals will treat patients who come to their door asking for treatment who are covered by this program. Because again, as we all know, there are lots of patients who currently, if they don't have any insurance or they're covered by a public insurance program, they go to the dentist, and the receptionist or the dental office, somehow they find ways of essentially refusing those people. So they may have actually got together the money to get the transport, taking the time off work, all that sort of thing, and they get there and they're subtly refused care. So hopefully that's not going to be the case here. So hopefully dental professionals will be paid reasonably well to do this work. And but again, as Brandon has just mentioned and I referred to earlier on, we have to find other ways of compensating professionals to encourage them to treat more complex groups.
And just to add a bit more to that, Paul, as well, is hopefully the federal dental program, from what it seems like, might start off strong, as we've seen with the increased funding in the 2023 budget. But one of the concerns, as I said, with the targeted programs where they have the possibility of eroding over time, we can see those gaps be created, as we see with the existing provincial dental programs, which leads to discrimination against these patients because, the program pays out lower fees. And one of the things that I see with a universal dental care system is that it eliminates that possibility because everyone's relying on the same government plan. And because everyone's relying on it, in order for the system to work, you need to fund it properly to make sure that dentists are being paid fairly, but also that we're looking at paying other dental providers fairly too, and more heavily, integrating the whole dental team to, doing a bigger role within the dental framework and not just having the purely dentist-centered approach.
Yeah, I'll build on that. And I think this is a great example for our CDM audience about this whole, fill the gaps versus universal approach that we often end up debating. And I think there's still a lot of unanswered questions about this program. And I think I saw some allude to this in the chat, just we don't actually know how this is going to interact with provincial programs that already exist. We don't know if this is going to lead to defunding of those programs or if it's going to lead to a back and forth where the provincial program says, no, you have to go to the federal government first. And if it doesn't get paid, then we'll cover it. And the federal government says, no, you go to your provincial plan first, and then you come to us. And so anytime there's that confusion, we know what happens. We know that people fall through the cracks. We know our most marginalized, individuals in our society have the hardest time navigating those complicated administrative tasks. Recent immigrants, people who don't speak English, people with disabilities, it just becomes so much harder for people to navigate those challenges in those moments. And there isn't the same political pressure or accountability when you don't have that universal program. There's also, you miss out on some of the strengths of universal programs, which, we sometimes and unfortunately still miss out on those opportunities in Medicare, but, you have an opportunity to do that health and human resource planning, which is something we need to do in Medicare more, but we actually, and that goes to Paul's point earlier about, the geographic distribution and making sure that we have the right providers in the right places, depending on the needs of those individuals. That's something that's much easier to do in a universal system than a fill the gaps approach. And similarly, we get to, exploit some really amazing efficiencies if we were to do it that way, where we can put dental professionals or alternative dental providers in long-term care homes, in schools, so that every kid gets their teeth cleaned in schools. And we've seen that work in certain provinces where it's been extremely effective in terms of improving oral health in children for a very long time. And so it just really highlights that while it's understandable that this is the approach, that it's politically more feasible, that it's financially more feasible, it's still only patching together something that would be a lot stronger and a lot more efficient if we just put it together as a single payer universal system.
Very well said, Hasan. Before I turn to just some closing remarks, I feel like this conversation, I'm so glad it's being recorded, and I feel like we need to replay it for all public healthcare advocates, because as soon as you start diving into this patchwork of municipal, provincial, federal programs, private insurance, either paid out of pocket or by your employer, it is such a lesson in why we need to hold on so tightly to our single payer public healthcare system and expand it as widely as we can. But I do want to give the opportunity, though no pressure, Mary, if there's any other words of wisdom you can share for public health and dental care advocates, as someone who's fighting for dental care in the US, but also in a context where you haven't achieved a single payer healthcare system either. Anything else you wanted to add? I realize because of this new federal program, inherently we had a lot of very Canadian based questions, but I do want to give you a chance to weigh in as well.
Thank you. No, I'm just honored to be with you all, and anxiously watching and learning about what's unfolding in Canada. As a journalist, I'm kind of on the outside looking into even our own programs here in the United States. I just try to witness and report on healthcare issues here. There's a lot of unfolding work here on some of the same challenges that you're talking about, getting the dental care to some of these groups that are outside of the network that we have now. And a lot of that is around workforce models, team approaches, some evolving things with teledentistry, some things that even happened during the pandemic with portable equipment, virtual visits, things like that you wouldn't normally think of in terms of dental encounters, but are actually showing some promise. Intraoral cameras, hygienists going out to where the patients are, whether they're nursing homes, congregate facilities, schools, doing the exams and the screenings, doing the routine things like the fluoride varnishes and the sealants on the molars of the children that are getting their molars, just getting those teeth sealed, and referring the ones with deeper needs onto a dentist. But just doing more. Dr. Satcher talked a lot about this in his Oral Health in America report, and it's that was 23 years ago now, but it's still kind of in progress here. But some things are happening. It's just fascinating and powerful to watch these challenges and the innovative ways people are trying to address them. And sometimes it is on a community basis, but then when you get people together from these different communities and they start exchanging ideas and talking about what they're doing, things catch on. And some of the reforms that happened after little Diamante died, and there were hearings about his death and lessons to be learned in all these different states, which had different programs, to meet Medicaid requirements for this federal program that actually entitled all child beneficiaries of this program to a full range of dental services, yet only a fraction of them were getting those services. Some states were doing better than others, and there were lessons to be learned. Something as simple as like providing Medicaid reimbursements to physicians and nurses who would do the routine well baby checkups on little babies coming in for their first year checkups as Medicaid beneficiaries, getting those physicians and nurses to look inside that child's mouth and check for, whether the teeth were coming in, giving them a fluoride varnish on the new teeth, talking to the parents, connecting them with a dental home, getting the children off to a good start. These were not large reimbursements for these medical providers, but it kind of bridged the imaginative gap between dental and physical care for the providers, for the parents, and maybe got the children off to a better start than they would have if no one had looked into their mouths, during that first year. So little things sometimes can mean a lot.
Thank you so much, Mary. And that, again, a whole new area to think about that seems so relevant to our work in primary care and in improving some of the foundations of how we take care of one another. So just taking a look at the clock, I just want to take a moment to thank everyone for joining us tonight. Thank you so much to our panelists for not just participating tonight, but for all the work you've done recently and over many years to improve access to dental care. Again, if you are on the line and you're a medical student, resident, or physician and not a member of CDM, please consider joining so you can stay engaged in these issues and help us work to improve Canada's public healthcare system and hopefully expand the basket of services so that someday we're talking retrospectively about the fight for single payer dental care. And for everyone else, please consider signing up to our newsletter if you're not already so that you get invitations to events like this. As all of you know, I'm sure there is strength in numbers. And so the more that we can grow these movements for better Medicare, the more we can improve access to care for everyone. And we're also sure that there is so much passion and knowledge amongst everyone who is in the audience. And we really want to work closely with all of you to improve care and services that everyone receives. So thank you again, everyone, for sharing part of your evening, and have a wonderful night. We look forward to continuing this work with you moving forward.